recommending the vaccine and saying, this is an important vaccine to get. And I think, sometimes it can be uncomfortable because of some of that pushback, in the media and from parents. So there are also campaigns for physicians, what are kind of simple ways of answering these questions for families and how to introduce the HPV vaccine as part of the whole package. Because really any vaccine a parent could refuse. It's just that kind of the way that it's presented. Like, you're going to get tetanus today, you're going to get HPV, you're going to get this, meningitis vaccine. They all kind of come as a package and how they're introduced. But just getting that message about preventing cancer and how important it is. So there's definitely campaigns for providers to also give a strong message.
And we do know, we had an interesting meeting here, and the senior physician in a large pediatric practice said it is the rule in our practice that all of our pediatricians introduce this. And one of the women there said, "I use your practice, nobody ever mentioned it." So it's not always the convention that it gets mentioned.
And a big focus of our campaign will be on providers and encouraging providers to do that. And we also have an advisory member who's very interested in working with a bevy of people on the policy and seeing if there's a way that we can get it in. So everything that we're talking about, we're going to address in the campaign.
We have three subcommittees, we have three subcommittees for the campaign. One is data, looking at data. How do we measure our rate of vaccination? How do we get accurate in this region? So how do we have a baseline? We know whether we're improving or not. We have another group working on parents and doctors. It's a subcommittee chaired by Bill Eisler and Dr. Alan Finkelstein, who is the chair of Adagio Health. And then we have a third, kind of funky, working with young adults, trying to get messages that are appropriate to young people so they will ask for the vaccine. So, and Women and Girls Foundation is helping with that. So we're trying every front to reach the parents, to reach young people, to ask for the vaccine, to reach the pediatricians and family practice doctors who will see the families.
So what's the role of the benefits?
We think that this will be an easier sell to parents and physicians who are reluctant. If they hear from a wise member of the family who has a certain, hopefully, stature and credibility, do it. Get the job done. What's this nonsense? So we're looking for the voice of wisdom. We're looking for the credibility of grandmothers, and I would say, at least in our family, the person who isn't filtered and does give a lot of advice as say, wow, the grandmother. And I think that the one thing we need is people who aren't afraid to speak out about this. It's just really a shame that we're not protecting young people. They are young. They are vulnerable. We're talking about 10, 11, 12-year-olds. It's really for the adults to make sure, and we like the grandmother voice. We like the wise, sensible adult who said, I don't want to confront my 25-year-old grandchild at some point, and they say, why didn't you get me vaccinated? So I think it's, part of it is just creating a lot of comfort with the conversation and a lot of urgency about, please get the job done.
I also think that one of the things that we can do is just become better educated. Still, to your point, I think that it would be helpful to create something, like a elevator speech that just has some of the statistics that we've learned, so that these are shocking numbers, frankly. I mean, when you really see, they're shocking. And so if we can speak the truth, I think that would also help as well.
That's your job, Karen.
I always have a lot of trouble with that. It's on the back, and then we'll move forward.
Hassan Güçlü, Pitt Public Health. We always think this problem is like a triangle or tripod problem, where we have the providers, parents, and the teenagers. it's very hard to get into teenagers' world. They have their own world. But I think the grandmothers would be the fourth leg to this tripod, and it would be something directly can get into it because they are not that authoritarian. They have some kind of relationship that is different than the relationship between the parents and the teenagers. With physicians, we think physicians is really important. We have a project actually working with physicians, and we are trying to talk to them to talk about HPV. They know that, but they don't want to get pressure from the parents because the parents think that if you talk about my teenager son or girl's sex life and a vaccine, they will become active with sex. So they are really afraid of that, and the providers are also afraid of getting pressure from the parents because of that. But we have this project, and we are working with physicians, 12 different providers, and we are trying to find champions in the clinics, not only the physicians, because physicians are not that, sorry about that, but it's not easy to work with them. But we are trying to find we are trying to find champions in the clinics. Could be a nurse practitioner, could be even the office managers who will push the HPV campaign with the. But now it's going to be hopefully easier with the grandmas.
I think that part of the resistance that Governor Perry faced was because it was believed that the vaccine was only for females, and some of the mothers were concerned about childbearing in their daughters' later ages. So I'm wondering, is there a bigger push now to get young men or the young boys vaccinated as well? Because it seems as though if we know that we're going to have our girls and boys vaccinated, it might be a little more of an easier pill to swallow for a lot of parents.
Absolutely, and you do bring up a good issue. Early on, the recommendations were for women. They focused on women.
Right.
Now it's absolutely males and females, and as I said, what was interesting to us, eye and ear came to us because of the males who were absolutely not getting vaccinated, and the throat and mouth and other cancers they were discovering among young boys.
And actually, the throat cancer, if it continues this way, will surpass cervical cancer in terms of being caused.
Sometimes we think of them as mosquitoes, the boys. I mean, they're not vaccinated, and they take the disease from somebody, a girl, and they take it to another girl. So they act like.
So it's a very good point you bring up. They both have to get vaccinated.
I have a question. With the grandparent group that you're trying to put together, has anyone thought about public outreach to, like, do you have festivals all over the city, all the time, everywhere? Is there been a focus group to try to attack high-risk teenagers or that group? Because they are, especially in the inner city schools and low-income areas, you have a high incidence of early sexual behavior that starts. So have we targeted those, like the schools, like go out and have meetings with the schools, because they are taught sex education in school. So as an education plan, has anybody thought about reaching out to the children? Because they might be able to go home and say, Mom, I just learned about this today, da 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 da. And it's, can we talk to the doctor about it? So you can educate the parents and the children in different media settings.
Well, the parent and doctor committee is definitely looking at that. It's chaired by a school board member.
Okay.
And we have a number of people from the education sector there. And you're, as they say, from your lips to God's ears. It would help a lot if the schools would get behind it. So we're trying, definitely, and be part of education. So we that's definitely an objective.
So if you're interested in getting in one of the subcommittees, how did you go about doing that?
Just Laurie Gottlieb, our communication director. Laurie's chairing the parent and doctor one. Some of us as grandmothers, we might have aged out of the youth to youth one. And then the data wonks are doing the measurement and data one. But I think if you talk to Laurie, she'd be delighted to have you join the committee on parents, focused on parents and physicians.
Hi, when are you actually going to start these subcommittees and start talking to the physicians? I mean, do you have a
Oh, they're on, they've already met.
Oh, okay.
We had a big kickoff in February, and we brought in an expert from the University of North Carolina who has the NIH grant to develop communication strategies around HPV, Dr. Joan Cates, and who's done a lot of research on this. So we kicked it off. We had a big meeting in February, but the 3 committees have all started to meet. I think the youth to youth one is just the last one to get off the ground. That's Women and Girls is putting that together. But the data group has met, and then the last week, the one for families, parents, and physicians met. And they all have chairs, and they're all moving ahead.
And sorry, I just have that follow-up. And what time, do you have a timeline for when you expect to start, or hopefully we'll see results or increased improvements in rates, or how are you going to, I know you have the data, but subcommittee, but when are you going to hopefully start seeing, or what is your future?
Well, I'm gonna actually let someone else answer it. The
Oh, okay,
data
yeah,
issue
sure.
is a big issue.
Mhm.
So anyone who chooses to, Nancy's gonna answer, the data issue we're working on, getting the numbers right for our region is what is a challenge for us now.
So there are national databases, there are state databases, there are databases that health departments report to, but they're all voluntary and they're all retrospective. So by the time you get the data, it's a year old, a year and a half old. That doesn't tell us whether we helped to move the needle. So we decided that one of the best ways to try to figure out who's getting vaccinated and what the rate is to follow the money.
Mhm.
So in order to get a vaccination, someone is paying for it, and the insurance companies certainly do track whether it's public insurance, private insurance. So they do track how many vaccinations they've paid for. So we are talking to the health insurers in this area. They've all been at the table and wonderful partners about how we can figure out how many are currently vaccinated, and then how many are vaccinated during the period of time where we have a campaign ongoing. What ages, what genders, etc. And the 1, the 2, and the 3. Actually, right now they only measure the 3 completion. So we're working with them to help us figure out the 1, the 2, and the 3, so we know where to put our efforts.
Just from a logistical question, is there work being done to make it one injection, one time instead of 3, and you would lose a lot less people?
Yeah, I mean, the problem with that is you need booster vaccines to increase the immunogenicity. So that just means, one won't be enough because your system is getting used to the vaccine, and then you need a booster to kind of boost that immune response. So like I said, there's always research being done on HPV vaccine, and every single year this committee meets and decides kind of what's the research evidence now. So they kind of have to balance what's the best way to get the best immune response versus the feasibility of providing a vaccine.
The CDC tells us they are working on it. And I don't know when it'll be ready. I couldn't agree with you more. Life would be simpler. They say they're working on it, but I'm not seeing it right around the corner. So, but there's definitely talk.
One of the questions earlier was about why the vaccine isn't being given along with other vaccines as a routine. And we didn't talk about policy, but one of the reasons is that it is policy that you cannot go to school without certain vaccines. HPV is not among them. And so it is a political issue to some extent. We can't wait for the politicians to discuss and change policy. And so we're working together to do what we can until then, but we have political power, so that's something else that we should be doing, is lobbying our representatives to bring this issue up and create some kind of groundswell of